Okay, well, the CDC, as we just mentioned, has issued some new rules about mask wearing, but let's get real. There are so many more questions now over this. What do you do if you're planning to travel? What about summer camp for the kids? There's a lot.
Yeah, and Dr. Leo Lee, he's an infectious disease specialist with Beverly Hospital, and he is joining us once again to discuss this morning. Dr. Lee, thanks for being here. We appreciate it. Now, the CDC has issued these new recommendations, but still says that people traveling on planes and trains and buses should continue to wear a mask. So what are your thoughts on this?
Yeah, good morning. Thank you for having me. Yeah, it's actually what a change compared to what we when we last spoke about 2 weeks ago. Right now, it is considered safe based on the current data that unless you're in a public area, say public transportation spot, the hub, airports, trains, they still recommend it because there are quite a few people out there in the United States who are still not vaccinated. Although being around them is considered a low-risk activity, as you come across more individuals who have not been vaccinated, you do have an increased chance of actually contracting infection. We do know now that the vaccines, data has shown that it's very effective. It is decreasing your chances of actually coming down with a symptomatic infection, getting very sick, being hospitalized, and even dying from it. And it also decreases your chance of actually passing it on. But for right now, when you're out and about in a large spot, as I said, when you're traveling using public transportation, you should still wear the mask for the time being.
And let's get real. We're also under the rules and guidelines of businesses, of the FAA, of county health officials who dictate what we can do. What should parents do who are considering sending their kids to summer camp, if that is an option? Because we've been getting notices that they're opening up. I take it, are our kids still going to have to wear a mask going to those?
Right. It's going to vary from place to place. Camps will have their protocols in place. Now, if your kids are older, basically, if your kids are 12 and above, the thing that you should do is get them vaccinated. This week, the FDA issued an emergency authorization for the Pfizer vaccine. So one thing you can do is actually protect your kids. Do it right now. In 5 weeks, they will be fully vaccinated, fully protected, so they can actually go to camp. They can engage in outdoor activities with other individuals and not have to worry about really getting sick from it. If your child is less than 12, it will depend on the camp. Most camps have, as I said, in-place protocols. That we usually have the kids together in pods, so they only work with one particular group of kids, and they can do it that way. Sleepaway camps may be a different story. Obviously, there are going to be indoor activities, and as you place kids indoors, especially for those who are not vaccinated, you do actually run an increased risk for them becoming sick or infected. But it'll be an individual choice, but each camp is going to be very different.
Okay. Well, Dr. Lee, let's talk about the variants. Can getting vaccinated help stop more variants? Specifically, how does that work?
Absolutely can. When viruses infect individuals, they mutate, and we know that. Viruses always mutate. So if you can actually stop someone from becoming infected, you can actually stop that mutation. So that's why it's key for us to get everyone vaccinated. The more people that we get, the better off we are, because hopefully we hope to reach herd immunity at some point. As of yesterday, we had roughly about 150 million Americans who've had at least one shot, and roughly about 40% of almost have actually totally vaccinated or are totally immune at this point. So if we can do more, we get more people vaccinated, we can actually decrease the the production or new variants from developing.
Okay. Yeah. Dr. Leo Lee, thank you so much for Beverly Hospital. We appreciate you joining us. Have a good day.
Have a good weekend. Thank you.
Thank you.